Hi, everybody. I'm David Allison. I'm going to go through a recap of all the details involved in treating the lady who was in the other video that you'll see in the program. This will give a detailed description of each instrument I'm using and how I use them, so you can get a better knowledge of how to do these root canals so much more efficiently. So anyway, we'll get started. I've already anesthetized. We've got an x-rays, and I've done a case presentation for the lady, so you can see that in another video. And typically I use Septicane as my anesthetic of choice with epinephrine 1 to 100,000. If the patients are sensitive to the epinephrine, I will use carbocaine 2% with neocobephrine. And I'll just show the patient what a rubber dam is all about. Most of them have never seen them. Typically, my selection of clamps, I've got 3 to 4 or 5 of them in each tray. One's for anterior, one bicuspid, and usually a couple of molar clamps for the teeth. Most of the time on anterior teeth, I don't use a clamp at all. I just cut or punch a large enough hole so that I can sling it around the tooth to be treated, plus another tooth on either side. It gives me better visibility of the angulation of the root axis. In case I have a hard view, you can tell the angulation of the burr going into the access. Once I get the rubber dam on, I usually have my assistant test it with the suction tip drawing air across it to make sure there's no sensitivity left behind. And we start our access. This is a porcelain fused to metal crown. I've got a number 4 carbide round burr. I normally have started, or I've been using a large tapered cylinder diamond burr to make my way through the porcelain, and then pick up the number 4 round burr to make it through the metal portion. All my burrs I consider disposable. They're only $1 a piece, and I just throw them away and use sometimes 2, 3, or 4 of the round burrs, making an access through a crown. As you can see, the rubber dam placement was only about a 30-second time involvement. Then the access is just a couple of minutes, sometimes 3 to 4 or 5 minutes. Once I make it through the crown and into the pulp chamber, I'll use a motion of more or less peeling the roof off of the chamber by drawing the burr up and down, or mainly in an upwards fashion from inside the chamber up the walls to peel the roof off. After I've got that done, I'll go back to the tapered diamond cylinder burr again and refine the walls of the chamber to make them smooth and to be sure I include all the orifices so that I've got good access and straight line access into each one. And there I've got the tapered diamond burr. These burrs are all so cheap. They're about $1 a piece, as are the number 4 round burrs. Now I'm going to identify the orifices of the canals. I've got the mesiobuccal located. I think the distal in this case, the mesiolingual, is still hiding from me, suppose. Okay, I'm ready to start measuring now. I'll typically start with a number 10 stainless steel K-file to work down to length. Of course, I attach it to my apex locator so I can know where I am. If I'm in a larger canal, I'll typically use a larger size file for my measurement. In some larger canals, the number 10 file is too loose. It doesn't want to stay still. It's hard to get an accurate measurement. So I'll go up to a 15, 20, or even larger if I have to. And I record my measurements on the tray cover behind my chair. You're not able to see the display on the apex locator on the table behind us. It has a bar graph that moves down to the 0 mark when I'm right at the apex. And everyone probably knows how this works. I use the apex locator called a Root ZX from J. Morita Corporation. It's been shown to be one of the more accurate, but there are several accurate ones on the market. We use a disposable pencil back there. We just throw them away. They're the same kind of pencils you find at a golf course. We tried sterilizing those pencils in the trays, but the paint on them peels off and makes a mess, so we just decided to throw them away every time. Measuring these canals takes just a couple of minutes, provided they're easily accessible. And after irrigating, I'll begin using my rotary file sequence. Start with the ProTaper S2, which has a white band on it and a white stop. The series starts with an S1, which is a lavender colored band. It seems to be too fragile for me. I just find it easier to start with the white one. It works well, decreases the number of instruments to use also. And I'm not using apical pressure. As it may appear, the instrument kind of draws itself into the canal. And periodically, I wipe the flutes of the file off to get the dent and debris out. So I'll take the S2 to full working length. Once it's at the working length, you don't stay there with it. You just bring it out immediately. You're done in that canal with the S2 instrument. Then the next one is called an SX. It's more or less an orifice opener. It's a 19 millimeter file. You can take it to full depth provided the canal is at least 19 millimeters long. And the next instrument is the ProTaper F1, which is yellow, has a yellow band on it. Of course, I irrigate between every couple of hand files and between every couple of rotary files. I'm going to leave the chamber full of the irrigant to keep plenty of fluid in there. Here's the yellow banded, which is the F1. It goes to full working depth too, but only for a second. Next is the F2, which is a red banded instrument in the red stop. I take it to approximately 1/2 millimeter from the working length in each canal. And the last one is the blue banded, which is the F3. And it's taken to approximately 1 millimeter short of the full working length. We'll irrigate thoroughly, get all the debris out. Then I do a final look around to make sure there's no other canal orifice to work with. And I think this lady, if I recall, she had some sensitivity still in the distal, which indicated a second canal there. Yes, add some anesthetic, just flush out that other canal with just a little bit of the anesthetic to anesthetize that spot so we get the tissue out, shape it also. I'm just going to dry the canal, or the not the canal, but the chamber enough to where I can get a measurement on that fourth canal. You just need to keep the files away from the metal in the teeth so you don't get a false reading. And we'll irrigate again and go through the same file sequence on the fourth canal. Starting again with the S2, and then we'll go to the SX, then F1, 2, and 3. Okay, that canal's done now. Do our final irrigations. We're completely finished shaping the canals. The rotary files do not need to be used in a recapitulation manner. They go into the canals one time to their proper depth and back out, and that's all. I use a number 15 file to make sure I've got apical patency in each canal. And irrigate again. Before this, I used an irrigation of EDTA and then back to the sodium hypochlorite for a final rinse, and now dry. I typically will use the coarse paper points as long as they'll go to the apex. If they don't, I'll use the smaller ones. The coarse ones absorb the moisture faster. And my assistant's already laid out gutta percha points on the tray, in the tray cover behind me there. So I'm picking the instruments up. They're color coded, corresponding to the rotary files. The last file used at the apex, which would be either F1, F2, or F3, depending on the size of the canal. I coat it with Kerr sealer and place it in, and just move it up and down a couple of times real quickly to coat the walls of the canal. I use a System B heat source. It warms on the tip, and I just plunge in, warm the gutta percha without apical pressure, then press down a couple of millimeters after the heat's let off, and let it sit for a second or two. Then activate the heat source again and let off, and then press down again. If you'll read the directions, you'll see exactly how I pre-fit the pluggers and test fit the gutta percha points before I put the sealer with them. This moves along quickly. The obturation takes anywhere from 3 or 4 to 5 minutes in a normal case. The System B heat source plugger goes to anywhere from 1/2 to 1/3 of the distance from the apex. So you've got the apical 1/3 to 1/2 the canal sealed with the gutta percha once I'm finished with that. And to backfill the canal, I use the Obtura 2 gutta percha gun to finish filling. And as I'm finishing up, I'm kind of discussing with the patient what to expect, postoperative instructions, which you'll get from me, then the assistant again, and one more time in written form. The Obtura goes in to finish backfilling the canals. As an endodontist, I don't get called on to do final restorations. If this were a tooth that we're going to have a final post and core, or just a core filling in the crown. This tooth needs a new crown, but if it were, you can go ahead and place that immediately. Seal mine with cotton and Cavit. Refer her back to her dentist. So we're finished within less than 30 minutes. If you guys have any questions, feel free to let me know about it, and you'll see a pre-op and post-op view of her final, or pre-op and final x-ray coming up in just a moment.